Avoid these 7 foods that can kill you. Today, I'm going to cover 7 foods that could actually kill you. Stay safe and better your health by avoiding these foods. 1. Green potatoes. When exposed to light, potatoes produce a toxin called solanine. In very large amounts, solanine can be harmful to humans. Greening in potatoes is a potential indicator of solanine, but peeling and trimming green areas can remove most of the toxin. Solanine can also cause a bitter flavor in potatoes. Very high solanine content in potatoes can trigger sickness and vomiting as well as pain in the gut. Most people who have been exposed to solanine will recover on their own. 2. Nutmeg. Nutmeg. If you use nutmeg, use it sparingly. Elemicin and myristicin, 2 of the active ingredients in nutmeg, are narcotic and have psychotropic effects. Vomiting, dizziness, nausea, abdominal discomfort, headache, tremor, chest pain, and tremor are typical unpleasant side effects. 3. Green raw almonds and raw cashews. Green raw almonds and raw cashews. Instead of buying bitter almonds, buy sweet almonds or roasted almonds. It's possible to experience stomach difficulties, gas, and bloating. It's frequent because nuts contain substances called phytates and tannins, which hinder digestion. Moreover, the high fat content of nuts can quickly cause diarrhea if consumed in excess. 4. Undercooked red kidney beans. Raw red kidney beans are poisonous if not properly prepared. Raw or undercooked kidney beans contain a naturally occurring toxin called phytohemagglutinin, also known as lectin. This toxin can cause severe gastroenteritis symptoms, including vomiting, diarrhea, and abdominal pain, within a few hours of consumption. To avoid poisoning, it is important to properly prepare kidney beans before eating them. This can be done by soaking them in water for at least 5 hours, then boiling them for at least 10 minutes. It is recommended to discard the soaking water and use fresh water for cooking. It's also important to note that canned kidney beans are already cooked and safe to eat. 5. Brown rice. Brown rice, along with other rice varieties, can be contaminated with arsenic. Arsenic has been linked to an increased risk of cancer, cardiovascular disease, and type 2 diabetes when consumed over the course of a lifetime. But this is not something to worry about if you include rice as part of a balanced diet. 6. Uncooked bloody hamburger. Raw hamburger meat can carry deadly bacteria like E. coli, Salmonella, and Campylobacter. These bacteria can cause foodborne sickness, causing nausea, vomiting, stomach cramps, diarrhea, and fever. Some illnesses may require hospitalization. Cook hamburger meat sufficiently to kill microorganisms. Ground beef should be 160 degrees Fahrenheit, 71 degrees Celsius. Before eating meat, check its interior temperature with a food thermometer. Good food safety practices include cleaning hands and surfaces that touch raw meat and storing it in the fridge or freezer. 7. Cherry pits. Cherry pits, also known as cherry stones, contain a compound called amygdalin, which can break down into cyanide when ingested. Consuming too many cherry pits can be toxic and potentially fatal. Symptoms of cyanide poisoning can include headache, dizziness, nausea, vomiting, rapid heartbeat, difficulty breathing, and in severe cases, loss of consciousness and even death. It is generally recommended to avoid consuming cherry pits and to discard them properly. If you accidentally swallow a cherry pit or suspect you have ingested too many, seek medical attention immediately. Symptoms of cyanide poisoning can appear quickly, and prompt treatment is critical to preventing serious complications.